On this day, the 3rd of January 2019, the Amish people welcomed the Beacon of Hope Outreach organization based in USA with its tentacles in Nigeria. The occasions showcased the Beacon of Hope Outreach administering free medical treatment in various areas of health challenges to the downtrodden people of the community and environs. The Beacon of Hope, also in conjunction with the Obiagu Okpala Development Union (ODUU), collaborate to organize a fundraising ceremony to complete their medical center, which hitherto was abandoned for the past 8 years. The medical services by the organization was widely rendered to nearby underserved communities surrounding the Amish towns as the underprivileged mammoth crowd thronged to the Obiagu Health Center to receive free medical care and free drugs dispensed to the patients. With her team of doctors, nurses, pharmacists, among others, the Beacon of Hope Outreach came prepared, fully equipped with a mobile clinic, as the medical personnel were fully on ground to attend to the much crowd. The event was graced by prominent stakeholders in the community, amongst whom were the traditional ruler of Amish, His Royal Highness, Dr. Barrister Igwe Afonsos of Obiike, Igwe Eneke I. Engineer Mark Oruche was the chief launcher. Other eminent personalities were the President General of Obiagu Okpala Development Union (ODUU), Architect Donatus Nzekwe, the President of Anambra State Association, ASA USA Women, Dr. Antonia Uche Ume, amongst other eminent personalities, were on hand to support the call for action. The founder of the Beacon of Hope Outreach Organization, Lady Chima Ekeze, was in her usual energetic attitude, held the community spellbound with her tenacious and commitment, in which she emphasized need for community partnership and community responsibility in a call of action in placing health as the utmost priority. According to Philip Ezoke, a professor of medicine, a team member of the outreach who led the team of medical personnel, recounted of how the health center, which was already in a deplorable state, when facilitated by the organization through the fundraising project, will go a long way in ameliorating the plights of the community who had been underserved for so long.
center, and I'm part of fundraising for the new health center. That's the only reason why I'm doing the interview. So all my dual role as the country medical director of Beacon of Hope Outreach, New York, the Nigerian part of it, as well as being the Obiagu Okpala Development Union Chair for the medical center. So I have a dual role. I am Umezoke Philip. I'm a professor of medicine and a retired consultant in accident and emergency medicine. That's who I am. But this is community work I'm doing. I'm a retired doctor.
So now, can you elaborate on your status?
Well, I'm part of Obiagu community. My involvement is at the level of aiding the executive that run the Obiagu Okpala Development Union across 36 states and the FCT of Nigeria in ensuring that healthcare gets to the grassroots at the village level. What we are doing is to facilitate the efforts of the executive and branches of Obiagu Okpala Development Union to bring contributions for healthcare funding in terms of funding for education, funding for medical missions, funding for water supply, funding for eradication of communicable diseases, in conjunction with the Primary Healthcare Development Agency of Anambra State and the government, that is the Ministry of Health of Anambra State. What we are doing is also to ensure that this health center, which is an update of a 40-year-old health center, becomes one of the referral clinics that refer patients to the Akulono Hospital, now the Diocesan Hospital in Amici, which is growing to the status of a district general hospital with a school of nursing. We aim to be one of the satellite clinics in Amici, as well as other towns, that will see people, treat whom we can, and increase the catchment area of the Obiagu Okpala existing health center. With the facilities we intend to have here, which will include diagnostics, which is one of our primary aims, we'll be able to amplify the range of services on offer to the community. Remember, we do not exclude people from neighboring towns of Ibuku, the Bulumili, the outreach border town of Otolo Newi and Osumeni. They are all welcome to this health center. It is also our hope that with the tarring of the Oto Amici Ibuku Road, which is about 50 meters from here, we will get a spur of a tarred road right to the front of this clinic, so that communication to here will be just driving or riding. So I am only part of a team. It's a multi-pronged team, a countrywide team, a statewide team, and a multi-factor team, both from the United States, from the government of Anambra State Ministry of Health, from the Anambra State Primary Healthcare Development Agency, as well as continuing and growing interest from the Anambra State Health Insurance Agency, to ensure that this health clinic becomes part of the network of health centers which the Nigerian National Health Insurance Scheme will feature as a place where the rural community gets health care. Today, we are here for fundraising, and it is our hope that having spent about 30 million on this facility, we can raise another 40 million in order to finish it, wire it, borehole it, illuminate it, and provide quarters for the staff who will run it. It is our aspiration that it has 24-hour accommodation, 24-hour staffing, and 24-hour electricity. So it is not only building a clinic, but also tapping resources like the Beacon of Hope, as well as other funders from across the world who are of Amici and other diaspora origin, to make sure that this place is a success. So it is a community effort, it's not a personal effort.
How do you see Beacon of Hope coming to the rescue of this community?
Beacon of Hope has been in Amici This is a step visit to Obiagu village. It was here 10 years ago or 11 years ago at the Igwe's Palace, and it was a free medical mission. That was just half a day. Then it was here 3 years ago for prostate cancer screening, as well as other non-communicable disease screening. That we did in partnership with the pathology department of the University of Nigeria Teaching Hospital, Ituku Ozala in Enugu. So when I talk of multi-factor contributions, you can see that our assistance are not local. We have assistance from out of state. We have had pediatricians. We have had laboratory doctors. We've had, in today's team, for example, we have ophthalmologists who have come from Owerri and optometrists who have come from Owerri for the Amici event. So it is a fact that having laid a track record, the Beacon of Hope Outreach Ministry, of cooperation with others, when they do need our involvement, Beacon of Hope also facilitates medical missions in other locations. So even though this is his third visit to the Amici Obiagu community in the past 10 years, Beacon of Hope from here will also be going to Anocha local government for another function tomorrow, and in 3 days' time we will be in Abia State for a one-day medical mission with this same truck. In the years past, we've been to Obiagu, which is in Delta State, and maybe in the year to come, we will return to Rivers State. So it isn't an Anambra State thing. It's a nationwide thing. Delta State, Imo State, Abia State, Anambra State, and hopefully we will increase our ambit. We've not been to Enugu State yet, but we shall get there.
Doctor, from what you have said, Prof, from what you have said, it's obvious that this is a very elaborate project that demands a lot of funding too. How do you cope?
There's a saying that the supermarkets have: every little counts. If we understand it, every little bit of funding counts. There will be those who donate the millions, there will be those who donate 500 naira. 500 naira will buy 4 cement blocks. 500 naira will buy 4 cement blocks. That is a contribution. 500 naira, if we get 500 naira, it will buy 1 bag of cement. So every little that anybody contributes counts towards achieving what the project wants. Sustainability is the other thing. Getting the project off the ground is one thing, but we need to pay staff after, and we need to fund the generator in terms of diesel and maintenance, and water is a borehole thing, and boreholes need maintenance. NEPA bills for electricity also need to be funded, and therefore it is not a fire and forget project. It is a project for which we envisage continuity in staffing, in service provision, as well as in visibility as to the benefits that will accrue to the community. Obiagu first, Amici second, and other neighboring communities also. It is not our view that will be selfish or that will restrict it to the locals. It is our view that those in need will be supported. There are partners even outside of government, like the Lions Club of New York, which are also partnering, and there are so many others that we cannot mention here. Pharmaceuticals, Allergan of USA. So in terms of interest in the past and continuing interest in the future, yes, it is a multi-factored, non-governmental organization in collaboration with others. What you see today is only part of an ongoing process which started about 10 years ago.
Prof, so far so good. We hold on pretty well. When the launching in English starts, the seeker will refer back to you.
Thank you very much.
Your patients are supposed to get updated and registered for the service. people who actually came for eye clinic being recorded. From there, they will consult the doctor. Drugs meant for distribution for patients are coming from. In due time, they will give you an update how it functions. Section, we have patients with blood pressure testing, blood sugar testing are being sampled, tests taken. In due course, we will update you on what is happening. Okay. Yes, this exactly is a urinary cyst section. You can ask her directly. So, what are you supposed to be doing here, madam?
If there is presence of protein or glucose in the area,
Okay.
after checking if there is present, then I'll refer the person to the doctor to get some further advices investigation.
Got it. I can give you an interview on what happened today, huh?
Thank you.
Please, nurse, please can you, in brief, tell us what is happening here today?
Okay, good morning everyone. Today we're here for the World Medical Officials, the people in our missing. Hereby we will give them full treatment and we'll check them to know if their health wise okay and if they are not. We'll administer drugs to them and we'll also help them get better health and give them health education talks on how to better their health. With this, we also give free drugs out to them and help them with their various health wise needs. Thank you. And I am Eze Gozianaka. I'm a nurse also from Unity.
May we have an idea of what you are doing here?
Okay, at this post, I'm checking my client's vital signs, which includes her sugar level, to check if she's diabetic or not, then also check her BP, her blood pressure, then her pulse as well, then her temperature. Then we also give free drugs for them for treatment. So we also educate them on the type of life they have to live, on the food to take, and being healthy, irrespective of their age. That's
And you think it's going to be a success story?
yes, to me and also to them as well, because I'm also gaining knowledge from them, knowing how they are living, and also advising and educating them on how to live a better life so that they can live longer.
Very well. We get back to you because, and what's your name? What's your destination?
My name is nothing, and I graduated from Navdas Korea.
Okay, that's great. Thank you. What is that? So what is happening here today?
As you can see,
Okay, Mira, please.
yes, and today we're running a free medical outreach organized by Beacon of Hope, a non-governmental organization. So Dr. B is my name, of course I'm consultant and seeing patients.
So precisely what areas of interest are you representing?
The medical team, family physician.
Okay.
Yes, so
You a medical doctor by profession?
yes, I'm a medical doctor.
Okay. In due time, we will keep updating your, what has happened here. We know precisely what you are finding is rural. So you can have an overview of what happened. Thank you very much. You're welcome. But we know your destinations, your area of interest.
Okay, family medicine.
You're a medical doctor?
Yes.
Okay, great. What is happening here precisely?
It's an outreach organized by the Beacon of Hope mission. Beacon of Hope Outreach USA. Nigeria.
Okay, we are told we have different sections. What section are you working with? Is it the
The medical consultation
medical consultation?
section.
Okay, we have the eye clinic.
The eye clinic.
Okay. And how many, there's another area we went to, there's a medical doctor there?
Yes, we have like 3 or 4 consultation rooms.
Okay.
So this is one of the consultation
So this general?
For general medical problems.
Okay. So we will be following you up, this, and maybe we might discover you have some beautiful discoveries today.
Oh, yeah.
Yeah? Thank you. Thank you. Please, sorry.
No problem.
Why, may we know what you're doing here, madam? Are you a nurse?
Yes, my name is Dr. Chiso.
Oh,
I'm an optometrist.
Oh,
So we are checking their eye,
okay.
and then after that we give them the necessary things that they need for treatment.
How far have you gone?
Okay, we've not really gone far. We're just starting,
Okay.
but we still have a lot of people that we're going to see.
Great. We'll be following up.
Yes, sir.
Yeah, and we discovered by the end of the day that some new breakthroughs must have been made.
Yes,
Oh,
of course, yes.
be watching out for it.
Yes.
Thank you, sir. Can we talk to him? Sir, what's wrong with you, sir? Why are you here?
Well, I'm here for my eyes problem.
Okay. And are you optimistic something will happen here today?
Oh, why not?
Okay. Okay, we'll follow you up at the end of the day.
Thank you very much.
To know how far you've got.
All right, thank you very much.
Thank you. And what's your name, sir?
Eugene Ezekiel.
Thank you very much. Did you get your name, Doc? Your name again?
Dr. Chiso.
Thanks. We come back. Hello, Doc. We don't mind. We can afford to miss you out. What's your profession?
Dr. Marshall, I'm an optometrist.
Wow. Are you impressed with what's happening here today?
Yes, it's a good initiative to have a health center very close to them. It helps with the sustainable development goals of the UN because it means that you just don't come and go. It means that once you, after the outreach, there's an available space for people to still come to assess their health. So it's a good initiative.
Okay. Maybe Zobios were just starting.
Yes,
Yeah.
we just started.
We will follow up and see how far you have got.
Alright, thank you.
Thank you very much. What have you told us your name?
I'm Dr. Marshall.
Okay, thank you very much. Sir, good morning.
Good morning.
Are you one of the patients we are consulting today?
Yes.
Okay, what's wrong with you, Professor?
So I just came to check my eyes.
Okay. You used to have an eye problem?
Yeah, I used to have. But when I come, they confirm
Yeah.
my eyes somehow bad.
Okay.
So we are trying to rectify it.
And obviously, I'm sure you're impressed with what is happening.
Very, very impressed.
Okay.
I'm very happy being here.
Yeah. And from all indication, when this health center is finally completed, I hope people like you will encourage an eye clinic as part of the medical attention given to this hospital.
Yes, by God's grace.
Okay? We'll come back to you later, sir. Thank you. What's the name again?
Yes, Anthony.
Thank you very much. Okay? Okay?
Assistant.
Okay. What qualifies you to handle this area?
Yeah.
To dispense glasses, am I right? Okay.
From the training I had,
Okay.
I was trained on how the numbers,
Yes.
number of by the numbers,
Yes. Okay.
left on the right hand,
Okay.
on how to give it to people,
Okay.
based on the doctor's instructions.
Okay, we'll be fortunate to be here again when you'll be administering a glass to somebody. So we'll see how you do it, eh? So far, so good. Thank you. Mama, at this juncture, we want to ask you questions, man. Have you been having eye problems, huh?
Yes, I have.
Okay. And it's like I saw them asking you to show what the drugs you were using before. They asked you to show them the drugs you have been using so that they will know whether it is still working with your eyes. Is that what happened?
Yes.
Okay. Okay. We are following you up because we want to make sure and we want to be happy with you that you got a better result than you used to have. At the end of the day, we'll still come back and give you an elaborate interview. Thank you, ma.
Okay, today the Obiagu Okpala Development Union, in collaboration with Beacon of Hope, Outreach USA, is embarking on a mission. And this mission is going to be a medical mission, which is already ongoing. You can see people going in. And there's going to be fundraising to complete this particular health center, which was built by the community. This health center was started 8 years ago, and you can see the building is still incomplete. Our goal today is to raise that awareness for people to come and make donations so that this health center can be completed. And of course, it's going to benefit and save so many lives, different communities, the entire Amich, the entire Newi South local government, Anambra State, West Africa, everybody will be coming.
From all indication, we are aware you're coming from United States of America.
Yes, yes.
And how have you been coordinating your programs there and your activities in your motherland?
Well, we were very busy. Like this year, the Asa Women USA, the Anambra State Association, Women in USA already embarked on the medical mission.
Okay.
We went to 3 towns. That was around July, August of 2018. Actually, when I say this year, I meant 2008.
Yes.
But this is now
Another year,
January 3rd, 2019. So we came to this Amich as well. And then we also went to Orija and Obu Town. And then somewhere around November, this committee, the Obiagu Okpala, which is my village, I'm from this village, they called me saying that we need to work collaboration to get this health center completed. So that was how the committee, the health center committee, was constituted. And then we started working. We've been having meetings, conferences, even when I was in US, until we came, because all the program, everything was developed. Yeah, teleconferences and all that. So today is to implement everything we have planned. I'm the project director for today's event. So I'm hoping, everything will work as planned. The Commissioner for Health is sending a representative. They're already on their way to come and be part of this launching of this program.
What is your impression so far?
The impression is great. I was impressed to see this building because I didn't know this building was here. We've been coming to Amich for medical mission, but I wasn't aware of this health center until around November. And being in my own village, I was glad that I'm part of it. It's an honor to be able to give back to my own community. So it's a good thing. When we go back to US, we're going back this weekend. Our goal is to get more resources to make sure this is completed as soon as possible.
What is your take on Beacon of Hope based in the US coming to reach of the indigenes of Obiagu? What is your take?
It's great. What Beacon of Hope is doing is to, again, that medical mission to serve the community. If you go in there, you'll see there's a pharmacy section. Well equipped, the drugs are there. There's an ophthalmology section for people that need eyeglasses. Eyes, a lot of people in this community have eye issues. So Beacon of Hope is well equipped. They have the eyeglasses section, they have the optometry screening, they have the nurses that are triaging, taking blood pressure, vital signs, checking glucose, and then there's a section for the doctors to see the patient. I'm very impressed because it's similar to what we do. And I already made my contribution in support because they are doing a good job, just like me.
How do you see the impact of this event in this village? this community?
The impact is great because people are going to get medication that they don't have, and they're going to get well. Remember, health is first. If you're not well, you can't take care of your family. So you can see these women as they're coming in with their husbands, their children. Everybody will be sick because we have a doctor. About 3 doctors are there already. They started this morning seeing patients. This elderly woman going in now is going to be seen. You can see she's going to be seen. She has her bag. We'll review all her old medications and then be able to counsel her and give her new medication. So it's something that will save lives. You know, I'm very impressed with what Beacon of Hope is doing. They've been doing it for a number of years too.
So, madam, what do you do for a living?
I have a doctorate in pharmacy. So I work at Georgetown University Hospital, Washington, D.C., in US. And that's where we get all our doctors, especially for my own mission, for the ASA Women USA. We normally come with breast surgeons. Because my own, the ASA Women USA is focused on cancer. Cancer and maternal health issues. So we see a lot of women with breast cancer, cervical, prostate. And we normally do surgeries at Nnamdi Azikiwe Teaching Hospital, St. Charles, Boromi, and General Hospital.
There is one mission.
So the follow-up is a continuous.
Yes, there's one mission. What's the name of that was held in Amici recently? By Chisco.
Oh, Chisco is my in-law. He's married to my older sister. My immediate older sister.
Are you part of that mission that came around?
See, there are so many missions. We partner with every group. We already know what to do. So when they come to us, we assist them. We assist any group. This is our town. We are all from Amici.
Now, off record.
Thank them very much because this is a project that is worth praising. So, not telling me, welcome. I will have contributed. Whatever the case may be, I'm going to give them what I have with those friends. Whatever I see, I'll give them.
Thank you very much. I appreciate. What's your name, sir?
My name is Pius Ikebude. My mother's house is there. I'm one there, neighbor. My mother is okay. My mother is neighbor. I know okay. My mother is daughter. So it's a pleasure.
Thank you very much, sir.
Pius Ikebude.
Okay. Well, everything unfolds, we might still get back to you, okay?
No, I'm going away now.
Okay.
Not from. So I just never. Yeah.
Yes.
When my drugs.
Yes, of course.
They gave me some.
Okay.
Wow. Wow, that's serious. Yes. Very serious eye drops. Yes. Thank you very much. So what are you actually doing here?
We are recording names.
Recording names of those that, yes. How is it done? In 2 sediments? 3 sediments. Can we have the sediments, sir? Those for eyes, good.
And
Other medical checkups, okay. How far have you recorded so much names already?
we recorded up to 60 names.
Wow, in less than an hour. This is beautiful.
People are responding.
Okay, so there's enough response. So this is the record session. We will still come back and get updated. Thank you. May we have your name, sir?
My name is Orakwe Dominic Ezoke.
Okay, thank you very much, sir.
My name is Ezoke Chukwudimeje.
Okay, please, we are coming back here again. when necessary. Oh? Thank you very much.
Drop it out. Those people are not available.
Do the camera.
Then reach out and say, what can you do? What can you do? So among that, then you will form channel to
Yes, I broke. Let it broke.
something like that.
Well, not to interview, so no problem. I will come here, come by. I didn't take the pictures.
Wait.
You're gonna get it. I was thinking about so now that we pick up the time.
I was planning to do
But
that.
that's the time you want to
Exactly.
But onto here,
It's there. Water. If you pick up
no,
water.
where is it? It's not
Not here.
No, water. Walk.
You may break giant down and find
Maybe there's an acre somewhere.
These are lots of
They pumping tanks and all the water.
So what we are going to do is,
And if you're promising water, we deal with water. Then I know somebody who has promised tanks back. Like you say, only my own day. Every day come somebody from abroad to see Niagara, but the tanks stand. They stand. Don't stand.
I don't know how that will work, because if they're doing the tank stand, how is it going to be, which kind of tank? Because the stand is going to be basically based on the fact that you put in rubber tank, you put in...
No, what he says he's going to do is he's going to do the stand. That is to take four. What's a four?
No, that's what I'm saying. That the building of the stand determines the tank.
That you will be over
The
there.
tank that will be over there. He cannot talk about four. Because assuming if you're going to do a tank,
100 liter tank.
like some tank that like in my house, you need to build it from the scratch.
Yes.
And the tank has to come with it.
Yes.
So you can't do half-half.
Okay.
That's what it's saying. Wherever you do the borehole, it takes the whole thing.
The tank,
Okay,
no,
so
the tank has
Because
to
you
come
can't
with it.
just put
So
the...
what he's going to do is that let him channel his strength somewhere.
Unless not just...
Because the stand will not solve a problem for us.
Yeah, without
the tank on top.
Yeah.
Because the stand must be based on... the stand on the aquarium was looking at rubber tank, which might not be there. Because my idea about tank here and borehole here is that at the end of the day, we are going to commercialize it in such a way that it's here for the hospital, here for the village, and then whoever is charged might be able to even sell water out of it, to be able to buy the zone to run.
Good afternoon. I got some more book. I got sweet. How are you today? Good. What happened to you? Why are you here?
Yeah, because of
Wow, can we have a self? What happened to it? An accident? Okay. How did this start? Was it an accident? Yeah? When you are young,
they cannot treat it.
Yes.
In case of
Okay. But they gave you some drugs necessary to relieve pains, which is very important for the actual orthopedic case. Have you gone to any hospital before now? Because of the leg?
They said the same thing.
Okay, okay. So, can you make a request to Beacon of Hope so that they can facilitate you to an orthopedic hospital? Not only referring you to, but they can, you know, sponsor your treatment. Do you wish to have that done for you?
Yes.
Okay. We will make such requests on your behalf. Eh? Thank you very much. What's your name again?
It's okay.
Fidelia. Okay. So we will get. She requires to see you.
Okay. Has she been in her leg?
And she made a request.
Okay.
That she will wish the Beacon of Hope will facilitate her being taken to an orthopedic. Hence, we are not going to do it here. That is her highest wish. Yes.
Yeah. What the organization is telling the community, health is the responsibility of each and every one of us. Health is first, and health is our wealth. The mindset of people to just to want to get free without contributing or participating. So Mama, as a community member, is from a family who she should tell her children, her in-laws, her Wadianas to come, that this health center is here.
Okay.
It needs to be completed so that people can be seen.
Yes.
We cannot cure Mama in a car.
Yeah, where there is no building.
What we are doing today is awareness to raise money to complete the health center. Until the health center is completed, that is number one. So that the community will now be able to see people. They cannot be wanting to get the free without doing anything. My question to Mama is, what are you doing towards Karucha Health Center?
Onye ọbụla tinyekwa aka ka ebe a gaba na ife a na-ayọ Chukwu. Everywhere. Yes. You didn't start.
Your health is your wealth. So it is not coming to sit down to get free drug, free this. If that guy is to do operation, doctors are here. Is this where you want them to come? Like this, to see you? Is this where they will do operation? So I want to know what each and everyone in the community is doing. What have you done? That is why we're here. What we are here today is to raise money to finish this health center. To raise money. This one is just the jara money. When you go and buy the garden, they give you jara. This is the jara that you know that if this health center is completed, this is the kind of thing you get. So the goal of this event is to complete this health center. Whether it is 1 naira, 2 naira, 100 naira, 1,000, 1 million, make sure you sow a seed today. Make sure you sow a seed today and the name of your family is represented. Don't take this medicine and leave. Go. You don't go there and sow a seed towards the completion of the health center. Nobody is charging you money, but you know how much you will pay if you have gone to the doctor, right? Okay.
May we know you?
My name is Ike. From this village.
So what is which?
This section is for measuring height and weight. So all the patients you are seeing we have to check the vital signs. This area is for vital signs. That's blood pressure, sugar level, height and weight. The vital signs the doctors need for their prescription. That's what I'm saying.
Okay, so far, I'll give you the response.
Yeah, the response has been very high, and we are impressed by the turnout.
Okay, thank you so very much.
Just with this program continue. Other times. Yes. Thank you. That's what I'm saying, because he's like the appeal of press. That is it.
Okay, Ofugo doctor. Okay, get to his way. Like if you okay, or drugs in here to be found. Okay, drugs. This is drugs. She has just seen the doctor. The doctor has, she has been seen, and the doctor has given her her drugs, which she will take to the house and start taking. Here's her son. The son has seen the doctor equally, and they've been attended to. So, Giniki and Wang, they become of home. Onugi. Giniki ya gwa become of home. Giniki. Well, thank you. Okay, so why are you here?
I brought my mother for treatment.
Okay. For what?
To old age. Health in the legs and all that.
Okay, so how your voice? Your voice. Raise your voice.
Okay.
Okay. Your name again?
My name is Patrick Endo.
Okay, so why are you here?
I brought my mother for treatment.
Okay. How did you get to know that something is happening here?
It was announced.
Okay.
And we had it, and my conscience are one of the people that let people in the village.
What is your impression of what's happening?
I'm very happy about it. I'm impressed.
Okay, and what's your message to people of home?
I want to plead to them to continue, because there is still hope of the less privileged ones.
Okay.
Yes.
And you are happy?
I'm happy about it.
And Mama is happy?
Yes, she's happy.
Okay, Mama down. What did you Mama na iji aka? Gini chọrọ ịgwa ndị wetara this medical mission ebe a? Gịnị bụ ozi gị? Gịnị ka ị chọrọ ike?
Ọsụ ka ihe ị chọrọ ịgwa ndị wetara ihe a na-eme taa.
Ebere m Chineke gọzie ha ụdị ihe ya anụmanụ. Obi dị m ụtọ.
Gịnị bụ afa gị? Okay, madam.
Ifo gini na-ewebata the best administration so far. Ọ na-adọ nwayọ nwayọ. Onye na-abata ọ na-ewere oche. Anyị nọ n'obu onye nwere aṅụrị. Ihe ọma emeela anyị taa. After 2019, after
2019. As well, he is our traditional ruler. This is his domain. So the organization is here, and if you look up, you will see that we have been here for years. If we take a look at the first one we did in the past, you will see right here, 2009. So this is not the first time the organization is coming, but this time the community have a health center that is not completed. So we decided we are going to do this in the health center. The aim of this event today is to raise awareness for people to know that the health center needs to be completed and equipped, so that when we come, we don't see people in the car. We don't see people that are on completed building. We could do surgery and do things to help the community. We are asking everybody, every member of this community, to sow a seed in this health center for it to be completed. Because once it is completed, it's going to benefit and impact the community, and it's going to transform this community and everybody. So I am welcoming the Igwe, and he's still going to talk inside, but just in case you want to make a few comments before we make round of what we're doing inside.
We're here because of the health center that we are trying to build here, and the help of the Beacon of Hope that is here today to try to help the community. I know it is not easy, and health first. And so many times in places like the rural areas like Amish, you don't have adequate medical supply. You don't have adequate medical treatment. And when somebody comes into this domain to try to build something like this, we are very happy, we are very hopeful, and we are very grateful, because a place like this is the easiest place to overlook. And we'll continue to build this place until it meets the standard that we want it to have. So that when people come here, they know that they'll get better treatment and adequate treatment, and they'll get better. So that's what we're working on today, and that's why we're here today, to give our support, to show face, and to continue to encourage them to do the right thing, because this is not easy. On behalf of the community, I thank the Beacon of Hope for all their efforts in trying to make this a successful endeavor.
What's your impression of Beacon of Hope coming this far to their...
I know it requires a lot of expenses, and the first step first, you know, when they keep doing this and keep doing it and creating awareness, eventually other people will step in and try to help, you know, because they cannot do it alone. And that's why I left everything that I'm doing, to at least to show face, to be present here, to show that we are supporting everything that they are doing. And the Beacon of Hope, I've been a contributor in the past, and I'll continue to contribute in making sure that their trips to Nigeria are successful.
Yeah. So what about the contribution of ASA women in the USA? Anambra State women.
Anambra State women, they are Madam Bata is here, you know, so they have contributed a lot, especially when it comes to Amish. It seems that most of the time when some of these things are being done, from ASA USA, Women Wing in the US, when they come here, it seems like most of their equipment and most of their attention are focused in Amish here, a little bit, more than most places. So we have monopoly on that, but at the same time, it's because we have Adadi Oroma from us that is doing it, which is Uchi Antonia Ume, that is doing it, doctor. So because we have her, you know, charity begins at home. So she starts with us before she goes anyplace else. And she's still, I see all the time that she's pushing women health, men health, general health. She's constantly pushing it. I see it on Facebook, I see it on WhatsApp, I see it on the internet, I see it on my email, I see it everywhere. And I wonder where she gets the strength that she uses to do all this work. But God is the one who is giving her the strength, and the God will continue to give her the strength to continue to do what she's doing. And she just celebrated her marital union, and we're asking God to continue to bless the marriage from now to eternity.
We'll get back to it at the end of this.
Oh yes, we did.
Yeah, we should not for help. Yes.
The representative. Okay, I'm here to represent
Obiagu Empost severally to do monitoring. So we in the primary health care agency, you know, primary health care is the first point of contact for the people before they cannot channel them to wherever they think they should get the pet. And we have been worried that in most places we have chanting they call primary care center, and most communities are feeling nonchalant. They don't want to contribute. So when there's a community like this, a group like this that want to collaborate with us, it's a thing of joy. So we are very happy with the Beacon of Hope Community Foundation for this great service to humanity. It's not just only Amish. Anybody can get treatment here. If I feel like getting paracetamol, I can easily get it. Okay. Okay, there was one time the assassin did something in Okija. Then I was the medical officer at Okija General Hospital then. So we know them. We know what they have been doing. They have been doing much for the states. It's not only in Anambra people living in the US or any other place. But these Anambrarians have shown that they are in the Anambra to the core. So we are grateful for that. Yes. And we say, we give you all the encouragement, all the support that you get. His Excellency has been working around the globe to make sure that the primary health centers are developed to a given standard. That even if you come from London, you can confidently go there and access some services. Our appeal to community is that it's one thing to provide facility, another thing is to assess that facility, utilize it properly. Some people will not want to. They will give one reason or the other. They prefer going to parks, they prefer going to chemists. But we are saying no. Patronize our facilities so that it will grow. You know now Anambra State are going to health insurance scheme. All our health centers are service points. So we are grateful that you have upgraded your own to full primary care center, which they will benefit from that. So we are very grateful. The state is grateful to the organizers for their support, continuous support. I was with Prof. the other time in October, last Sunday of October, when we did presentation on immunization at EHAL, and so we talked at length. So I am very happy, very grateful, and on behalf of the state, I want to encourage you more and promise you that put this into full use as a primary care center. Thank you.
Thank you.
Please, may I ask you, sir, what message are you taking back to the government of Anambra State? Now you're here, you've seen what you've been able to achieve. Yes, precisely.
Can I come in?
Yeah?
He will let him answer that when he has seen where we here, when we have gone round, so that he will be able to comment, give an informed
Anyway.
Yeah, we made it round right now. We're going to start the event.
I can see answer now.
Yes.
You can see answer now.
Okay.
The core message that we have gotten a reliable partner in delivering care services to our people. That is the core message. We have people who are willing to develop, invest, and see that our people get the best of healthcare services. That's the core message.
Are you sure the government is willing to partner?
Yes, government is
structure at this level.
No, government is willing. Like I said, I've been at the airpost, right, to do supervision. That day, you didn't even tell me that I was a social like this at the airpost. So now that there's a structure, the message has gone to the right place. Commissioner is aware. All we have to do is to key it into and do the needful. Thank you very much, sir.
How long is this needful?
As soon as possible. As soon as possible.
That's why we're here. We want to complete this so that we will join in the in whatever healthcare scheme for the government.
We don't need it. If we are going to finish it, then we don't need it.
Okay, take over.
He's saying that they are going to partner with people who are willing to make progress.
Yes.
He is now saying that he didn't even know there was any structure. This way. All right. Now that you've seen the structure,
Awareness.
he did ask you a question. What are you going to do? He said, okay, you're going to communicate to your boss.
Yes.
And he said you have a life. That's why we're saying, what time lack?
Yeah, that's like I said, as soon as possible. Yeah, as soon as possible. Because once I get back, I'll give you feedback.
Communicate.
And then he will do the needful. Already he's contact with you. So that is it.
And he has a plan. We're ready for what they can plan. He has it.
Thank you very much, sir, for coming. Thank you. Thank you, sir. We're grateful. Please, can you have that?
Okay, can we?
Thank you very much.
Thank you so much. Okay, at this time, of the health center have already been communicated to the commissioner. The commissioner has taken a look at it, has made comments. So so he's aware. So we just using this right now for the preparation. So here we bring back kind of way. We have the lab you can see so that they could have the urine because we do urine analysis for urine testing. And here we have our mini lab where she's testing people for the urine. So you can see everything is improvised, and that is why we're here to complete it so that we can give full modern service. On this side, you turn around, you see where they have their glasses lined up and the eye test. Exactly. There you go. Exactly. So we have the glasses here. Okay, this is the pharmacy section. We have 2 drug lists. Medication. So the doctors give this out, they come in here. Anyway, this is our own mini pharmacy. We have 2 prescriptions. We have the prescription for regular medications, and we have the prescription for eye drops and the eyeglasses.
Okay.
So everything is already ready. Once the doctor prescribes their name, labeled, however you're supposed to take it.
600.
Exactly. So milligram. Yeah. So these are the meds that are on this list.
Okay.
So the pharmacists give it out. On this section, you have the eye drops. All the eye drops are here, and this is the eye drop medication. And then they get the eye glasses. So this is what we have. So yeah, for pain. For pain. So at this point, while I'm taking our representative and to the car, everybody. I didn't tell that call. Let me try that. Project of addressing the barriers that hinder girls' education. Like we got donation that have to do with girls. We got sanitary pad donation for all the girls that come for the medical. We got toiletries. So some people just want to help girls for them to develop to their full potential to be women of substance like my sister here and my sister here. So it's very important that we encourage these girls. So we're going to start the girls initiative in this meeting.
You have to join.
Maybe just
for health reason.
Yes. Yes. Okay. So this is the van. Also have
okay.
They have a restroom.
Yes.
The water runs, it flushes. We have all our supplies in there.
So where did you get this bus from?
Donation from US.
Really?
That's why if the community come, you could get things.
Yes.
If you put it right and send the message out there. They will help you.
Yes.
So the thing is that even if your community don't want to help, you encourage the people who want to bring things for the community.
Yes.
You may be surprised the people that we have your community is not your community members.
Yes, it's true.
You understand? And she's very much aware. The people that help what she does is not from the community.
Yes.
So you go ahead and work with the people who have the willing heart. Not everybody have the mind to give.
Yeah.
You understand? And go ahead. So these are what we way. And like you said, we wanted. Usually we try to like use this for more private thing like HIV, AIDS, privacy, nurses, and all that. Or move some of the doctors here. Like tomorrow, this particular section is going to do the girls. It's going to have a female doctor and just watch the girls.
And that's the inner room.
Yeah, that's the inner room. Supplies.
So that's the blood pressure medicine.
Yeah, every room is equipped to take, like let's say you have more blood, depending on the community we go to. If we need, it's a moving clinic.
Yes.
So if we go anywhere, we don't have like the space we have over there to put stuff. We put doctors in. Yes, exactly. we use them. It's fully air conditioned. It is. It is.
They have this in the US too. When they move around.
They move around with the van. So be careful. So now we're going to the mall. We'll go get the money. Build the health center.
Hello? Have you checked here? Yeah. Are you ready? Going on here?
Oh, there is a very great one.
And this is she's sincerely the finest of the programs.
Yes.
Because it's been handled in a mobile
clinic. This is a mobile clinic.
Yes. So how far have you gone?
Okay, well, of course, we're attending to patients. A lot of activities are ongoing.
Okay.
The nurses station, the pharmacists, the laboratory scientists. So we're working as a team. You can see I'm consulting and attending to a patient, and everybody is happy.
You mean the pharmaceutical groups are here too?
Yes, they are here.
Very interesting.
They are here.
How many patients have you seen today?
Oh, many patients.
Interesting.
Many patients.
Okay.
So many patients. When you go through the records, you get the exact number of patients. Yes.
From your observations, do you have very peculiar cases that you've not that are so?
Well, yes. Of course, especially the locally endemic diseases, ranging from hypertension. Diabetes, osteoarthritis, and all that. A lot of them. Yes. And I'm happy, of course, with the medications we have.
They could take good care of all that.
Exactly.
Wow.
Exactly.
We are sure that in a matter of days, weeks, we'll be getting results and returns from your effort and your input.
Very much.
Yes, thank you very much, and we will keep you abreast with the developments.
Yes, sir.
After this program.
Yes, sir.
Because we'll be on the ground.
Yes.
To get information from our clients. Yeah.
Yes.
Who will now give us updates so that we give you feedback. Thank you very much.
Very important.
Mother, what's your name?
My name is Florence.
Yeah.
My name is Florence.
Where are you from, ma?
I'm from Obiagu.
Obiagu here.
Yes.
So you'll be on the ground for us to reach out to you when necessary.
Yes.
Because you are going to give us updates on how you have responded to treatment given to you.
Yes, sir.
Thank you very much.
Thank you, sir.
So, I wish you a speedy recovery.
Thank you,
Right, thanks.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done on earth as it is in heaven. Give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. Amen. Our Father, we thank you this day. We give you glory because you are the Almighty God. There is none that can be compared to you. and none is like you. You are the Alpha and Omega, the beginning and the end. Everything came, after you. You made everything for your glory. We thank you this day that you have made us to see 2019. A lot of people pass to the great beyond before this year. But today you have given us the special privilege, not the right to be alive. We give you glory in the name of Jesus. For our health and for our village, our families, our parents, our wives, our children, everyone is around us. We thank you for our lives. Life is above everything. He said, you give life to your Lord. Thank you that because of life you give it unto us. Because in the land of the dead, you are not praised here. You give an opportunity to praise you. It is a landmark for us to be in your presence to praise you. Angels in heaven are there shouting hallelujah to your holy name. Thank you for counting us worthy to be among the living saints, to be praising you, accept our glory and thanksgiving in the name of Jesus. Thank you for this appointed day also. Because you are God. It is a day that deserves their glory. We will not be consumed in the name of Jesus. We will not be consumed in the name of Jesus. Our Father God, as we are thanking you, we also ask for your mercy and your forgiveness. If this day we have not seen you, we will get to a liar, and I know our God cannot be a liar. The Bible says, the prayer has made us holy, acceptable before you in the name of Jesus. You have not called the seed of heaven to sleep in bed. Father God, our coming here is not in bed in the name of Jesus. There are children that have gathered unto you and not unto man, to seek your face, to appreciate you, and at the end be blessed of you in the name of Jesus. He said in Psalm 24 that the earth is the Lord's and the fullness thereof. Whatever we are doing here, whatever condition we are doing here, is to all your glory in the name of Jesus. Mercy rejoiced over judgment in the name of Jesus. Lord, wash us clean, wash us. We are like little children that bake on the tummy. Wash us and make us acceptable in the name of Jesus. It is not your intention to punish us. As we have seen, Lord, pick up the right hand, use the left hand to bring us nigh to you in the name of Jesus. Therefore, at the end of this hour, we are committing this day unto the hand of God. The Bible says, whatever that is committed unto the hand of God is saved in the name of Jesus. Our gathering today and this event, you will commit unto heaven in the name of Jesus. Our brothers and sisters and invitees who have been invited to this program, we commit unto heaven hand. Jehovah God, lead them, be with them. When Moses was to go to the Canaan land, he said, I will not go unless you go with me. Lord, go with us as you went with the children of Israel in the name of Jesus. You told Moses, I will be before you as a pillar of cloud in the day and as a pillar of fire in the night. So shall it be for us and our invitees. They will come before us. They will come in your presence and they will honor you with their fruits in the name of Jesus. We that are here, this foundation that is being laid today shall not be put to a stop. That no power can.
Thank you. I want to present the chairman of the health committee chairman and the president of the yes. Dr. Thank you.
Good afternoon. We will all do the time. Apology, come on, apology. All the time. I have final table. Yeah, well, I know you video.
Ndị be anyị ekele ụlọ ụlọ afọ
na-emeta ata n'ihe anyị na-eme bụ ihe ga-eweta ọganihu n'ala anyị ji na n'Okpala na n'Obibi na n'Obiagu ọ ya ga anyị na-emeta ata ya ka anyị na-egwure gbakọba ọnụ ọ na-akwụkwọ unu ebe alụrụ ebe ndị dọkịta na nọọsụ ga na-afụ ndị mmadụ wee na-enye ha tata ahụ nnukwu ụbọchị ọrụ maka na nwere ihe ọ na-eme oge ewu ma anyị gbapụ ndị dọrọ bịa anya na-egara ya anya ya na-egara anya na ahụ ihe gbasara etu anyị si enwe ka anyị nwere ike ka anyị were nwee ike wee bi ogologo ndụ na ọ bụrụ ibi ogologo ndụ a bụ ndị ga na-eche blood pressure oge ọbụla ọ 120/80 mana ihe ga-enye anya ahụ nke dị na nke 80 ya ọ gbagobara na ruo 1995 ịgbadojebe na nke dọkịta onye ọgwụ ọnụ nwekwara ọgwụ ndị egwu na ọgwụ ndị ahụ na kọsụ kansa and so ruo na-agba dọkịta osi ahụ bụ ọgwụ ndị egwu na kọsụ kansa ọ na-emede ya ọya anyị nwa ya diabetes ya ọya shuga ka na 100 mana ibido gbadebe ya ọ ka na 140 the man is diabetic ịdị diabetic onweghị ihe ọjọọ dị na ya idugbu hypertension onweghị ihe ọjọọ dị na ya nọ n'ihi ebidozie na-aṅụ ọgwụ mgbe dị diabetic na-eme exercise ọ bụghị na high blood pressure you need to make sure you get enough rest, enough sleep, and then you exercise in it. Now what you need. How many diabetic? Only half of and what's next? Although who's done they know it, no, I will want it. Now too much of anything is bad. But what I found out that no na n'Obiagu when I mean pastor the one ada from was the idea that we have all the money we are doing we have all the donation we get cheap money pay all the thing that very different and you get up and you know all to see that I'm here I don't believe in God is not a religion. Let's be good and take out a religion. If you are going to buy a religion, I want to go to the game of the Bible, in the Bible, and the Bible, and start there. When all we hear the go, you are going to go there. That can do it. Second years ago. That can do it. Man, as long as you charge the money, now you should not contribute to no Nanya high blood pressure, guy with diabetes. And 2019 and 1 million. About not done I'm off enjoy. I will mean I never. You know where that. If I will that. Okay, you will that. I know you are. What you don't like me and president. I'm not going to say every president that you bring to the president. I want to know about Manopona, when you are successful, Obiagu is successful. Can I get you? I'm not successful, Obiagu is successful. I can't let you go. Transportation there. Most of the things are all the time. Yeah, you go there. All of them buy in your support. In the Lagos, in the Lagos, all of them buy in your support. I'm going to go here in your support. So we'll make you all Sister Chima, thank you very much. Maybe still on the line. It is not a line. Orphanage, give it king and I'm never. What's not a client and myself for Jesus Christ.
Agada Chamber, and thank you for coming. And I was saying, the chairman of the Annual Secretary, Ilan Abdullah number 3, remarked by the head committee chairman. Obiagu,
since 1950, they will be here. Obiagu, I want to say more Pakistan, the health committee. They don't see talk. No more for me, and that will that. I need to go. Almost all people know. No go. Can you hear me? Uncover a health center. And you when the general hospital and about that teacher hospital manage. I need something. Give me back. Although we don't know we are media, I want to tell you, also the area you live in, and you will go and see you look like that. I need to do. All the back and we cannot chop the enemy man. You will go in a sugar, go back blood pressure. I'm an underband in a health center. I'm a father now, what I mean, I know 500 naira bego, 5,000 naira bego, 50,000 naira bego, come on, 100 naira bego. Go in the way, no, I hand ball. I'm my Obiagu. Well, Palo in a health center, and a half woman. Omani you, Omanazu, Mahasana, Mahasane, all Tani. Well, Palo in a health center now. Now, we are Bushaya, who don't know, oh, my God, when I see, if I know how to present general, well, one man in the gym. See, women in the state, well, we're not home. Where's the hour 20,000 naira with charity?
The
a lot of people have spoken, so I think I will sing. Come and see, oh, come and see, come and see, oh, come and see, come and see, Obiagu Health Center, come and see, Obiagu Health Center. The main purpose of us being here is that this health center is like one boat owned by so many people and designed of all. will the caliber of people to visit this health center. And it does not matter. What we get today is what I call the call for action. You cannot sit where you are and expect somebody else to do all the time. What are you doing for this health center? And don't tell me you don't have money, because it is not all about money. Most of you have in-laws, friends, connections that you will appeal to come and help us to finish the health center. I am not going to talk more because we want to raise money, but all I'm going to say right now is that this health center is going to be achieved by what I'm calling the power of one. The power of one. It does not matter whether this hall is empty. It does not matter who came or who did not come. It does not matter the politics going on in the community. What matters is you, the power of one, because one person can do this. One person can do this, irrespective of what anybody says or does. Once you know what is right and you do it, we are going to continue doing this annually until this health center is completed. And it is our generation that we complete it. If I do, then this health center is a living legacy that stays. It is our generation that we complete it. For children set unborn to come and see, there will be a wall of fame in this health center for the people that completed it. If when people start something and they don't finish it, they didn't do it. If you start something and you don't finish it, you've not done it. It is when it is completed, then you will say that you have done it. So this is a new legacy for this health center. We are going to do what? Complete it in our generation with the power of one. So now I'm going to give you a lesson. Give me that baby, what will I do? That health center is like a house. You go there, you knock. What will I do? Will I do one window? Will I do borehole? Will I do this? Will I from my phone send messages to my relations? Will I put it in Facebook, Instagram? This is a community's cry for help. And ODUU, Obiagu Development Union, we are stronger together. We will achieve this. One building is not going to be greater than the community. The power of one. What will I do? So don't point and say, what will you do? What will I do? What will you do? What will you do? What will you do for the health center? What will I do? 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 Get it and give me. 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 Amen. Unu manu ni hada da meta de unu ke fi chan moje. Ana mo ha. Ada wa le bu wa le me. Aya ma no ha. Aya le ji le me gele. We no ha. The Honorable, this is an initiative for community responsibility and community and participation to move forward. It does not matter what you have, it is the spirit of giving that we move forward. President is saying, well, you can ask that something. They get each other now, we start this initiative like USA encouragement to keep doing. 30 years ago, 30 years. I got my dad a very good guy. Who do you channel at the to raise money for the health center. Can it be a complete day? And it's not a one-day affair. Oh, I'm going to project that with a separate account. Each day, where support behind it. But the promise that this committee is giving you is that whatever $1 you put here, you will see the impact. You will see the impact. I hate the transparency and the work being done in the health center. We will come again and we will keep seeing what we have been doing. Thank you so much.
So with 10,000 naira. I'm so happy. My name is Shima. My
onye n'uche na-eme ọnụ a na-agụ ebe a. Achọrọ m iji aka nna m tiri ọjị mgbe ezuoke 10,000. Tiri narị ise mgbe ezuoke 10,000. Mgbe m si aka m ọ maka 10,000.
We thank God. Thank you so much, everybody.
Obiagu wo obodo ya wee bata ichefuo na owebe si wee bata ya mana owebe isi wee dị iche anyị wụ obodo pụrụ onwe anyị n'anya nkwa ndị enyi anyị n'anya onye ọbụla dị obere ije ụmụ nwaanyị anaghị na Obiagu ọ na-ejidezbe nna ya Obiagu ụlọ ndị ọkọrị obodo ya ịpụta ịpụta nwanne na nwanne a na-atọ ụtọ ụlọ ma hisi ọkụ Obiagu ọ ewu isi na ala Abich Abich bụ ụgbọ Okotu bụ ụmụ asaa nwoke asaa agazi elu agazi ndị ugwu obodo ha Chida Abich na Ọsụgbelu mana agada Abich senatọ of Abich Obiagu isi onye sa anyị na-azụ ya anyị bụ diọkara ọ ya mere igwe ji wee nọrọ tude ụrụ nwa afọ Obiagu maka na anaghị azọ igwe azọ anaghị eme ya mgbagha ọ inheritance of ndị isi maka na ama mbụ gọọmenti chọrọ inye isi ka aka mụchara igwe n'obodo a ebe ụzọ kpọọ ndị Abich kpọpụta nna ya igwe Abich were ọgbaraka wee nye ndị ọgbara sọ ọgbara kpọpụta nna ya igwe ndị ọgbara were ọgbaraka nye ndị olu iwu oke kpọpụta nna ya igwe ọ ya bụ ụzọ igwe anyị igwe eleke nwa ọba Abich that is from Office of Commissioner for Health. Maka na ọdịghị isi mmadụ ya bụ ihe ọ na-eme wee spare 1 minute of this hour I can give this period wee bịa ịkpanyere anyị maka ihe ọnwa na-adị mma n'obi akpọ ọrụ oke ịza ụbọchị ọzọ ihe akpọ anyị ụka ya zakwa ya so my brother you are welcome biko ụmụ nwanne m as na onye ụgbọ adọ n'ụka nwere ihe anyị gara ebe a tupu bụ maka health center anyị ebido and anyị ga-arụsịrị Jizọs name amaka ọ dị njọ mmiri ga na-eso ada ozocha gịrị anwụghị acha so na health center anyị abụgo ihe m na-akpọ ụlọ na unu ike ụlọ gafere ebe a by the next 3 or 4 months unu ya amasị ebe ọ bụla na-amasị imagination Obiagu nwere mmadụ anyị nwere ndị ọyị anyị nwere ikwuru ube zuru ka eme ihe ha na-achọ ka anyị sị ha dịkwana ihe akọrọ anyị nwere anaghị ọpụtago ewepụta ọkụ egwu ihe mụ na ekwu nke akwa ahụ na ama m ndị anyị ji eje mba ha zuru ezu ha si anyị gaba n'ihu na nke ebido ofe ntụcha na before 3 or 4 months a lot of changes in this place.
na-eme ihe na mba a na-echi ha echichi. With time, Obiagu ewepụta ebie a na-akpọ Obiagu bie. Anyị je recognize ụmụ anyị na-emere anyị ọfụma, ndị enyi anyị na-abịa akpọkwunye anyị ma ịkpọ ọhụrụ. Ọ na-azụ Obiagu bie, anyị chicha ha echichi anyị na-ede igwe anọ ọrụ na-ekpughe ha one by one na-enye ha n'otu. So that in time to come, ọ ga-adị known na this town ka na-ewekọrọ ndị ọbịa na-recognize ndị na-eme ọfụma n'obodo na ndị na-enyere obodo aka. Because ịkpacha ego nwanne ga-agụ na-aga ya ọ na onye mkpọrọ afọ ebe ị na-esi akwa n'ụzọ nwanne gị kpara ego isi ihe jiri gị ego ka iwere nyere ndị mmadụ aka so na ndụ wee kpara gị. So biko ndị na-egemere anyị ihe ọma na n'ụlọ ọgwụ atụ nke aka na ya na aha ya gbara ahụ aji emi ọ ya adịba forever and ever onye tolite ejekọ ya na ọdịda na ụlọ ọgwụ anyị wee bụrụ ihe ahụ kwa na-ekwu onye ọra egemere anyị ndị because na anyị gbara comfort men, the health center proved out. He had a visual view, the specialist together at the back, they were all so that every single one of Lagos will be a beach. Yellow beach. Obiagu and Obiagu ekele m obi tegara ebe a ndị otu anyị type of orientation na-abịa ha nọ n'ụzọ onye luz na no because anyị mana ọkpọsta ọkpọsta akara aka agụrụ eche mba anyị ga-ebe agụrụ ya highly welcome. Biko nụ nwanne m anyị nwere obere okwu nkịta ahụ ịbanyesi na ihe a na-eme. Obiagu bụ obodo peace ya aga ha nọ n'azụ ndị peace anyị aga n'ihu ha nọzụ ebe ha nọ. Onye achụrụ onye chi ya achụrụ maka obodo a maka ọtọka ka ọtụtụ ihe so we must move forward. Onye ọbụla akwụkwọ afọ Obiagu megharịa ihe a nọ n'ime ya ọfọ 2019 ọfọ obere Jesus Christ abịa onye mabụ ya abịa ọfọ obere ọbịa so na ihe ya nọ ka ofu ya bụ onye abịa ọ bịa ha nwere ebe n'ụlọ obere ebe ya ọ ya Joji, yes, sir. Obiagu, ekelekwa m ọnụ. Ekelekwa m ọnụ.
Biko ka aka ọ dị iche aka ọ. Ọ bụrụ na lepụta aka ọ ya. Ya na ọ bụrụ na ya Leze ka achọla na n'azụ ụlọ n'ọrụ ebe a ka ọ dị n'ozi ga na mmiri ọnụ. Nwanne anyị nwetara ilu agbafụsị plastik Nnamdi onye na-anọchi anya the Commissioner of Health and Project ka ọ gwa anyị okwu gwara anyị ka ọ na-ekwuzi okwu ka anyị gee ntị.
Ka bido etu protocol igwe elekewa igwe famili President Obiagu Okpala Deputy Union Emeregwu Adadioram Ikedekwani ndị Obiagu kwee enwere Obiagu oge ezechipụ unu abụrụ ndị ezi na ana-alụ ka a na-agbakwa eze ga-adịkwa ndị ọzọ maka onye gọọmenti na-azụta na-azụcha agara inwe small things n'ụzọ ndị ga-adị obodo egwuregwu sisa ndụ eziokwu ndị a na-eche n'ịga ahụba n'ihu akwụkwọ kwesịrị ya n'ore steeti weta polisi ndị na-eke nsogbu ọrụ ndị na isi ọchụ asị ga polisi primera n'ichide sayens tara na nsogbu ebe a ụzọ azụ igbo ejebe ọka onye akụ egwu ọrụ na ka kwesịrị mmiri ọkụ ọsị njem isi ya maka ihe anyị nche n'ụlọ so ka ndị ọ na-agba egwu ahụ ka a nọbụrụ egwu na onye a na-abụla dị ọ na-apụta na dọkịta dị ihe na na-eji dị free so ya na-ekere maka nke awa na Commissioner for Health all because of ihe mere n'Enugu mortuary bụ ihe mere na ọbịa tata all later who send the message say them spirits are built and say I'm here. Never found no more anything other than going. The country may can get me was still about even the boom in the up by a also. No, when I walk, I have one month. So, here, Pedro Park in as government. Outside center of the program, it's already it is approved as a health center. I'm not going to be the full-fledged health center. Because on the program, all I know all of you also are there. Issue of health center, community participation. Ndị community so na-eme nabata ya ka ọ bụrụ nkefa na-adị anyị mkpa. Onye ọbụla edebe pawa ya na politiks dokwu ya. Ọ bụrụ ibi ịtụ ego ịrụ ụlọ bisi okwu, ọ bụrụ na ọ bụ ụlọ ọgwụ. Ibe bụrụ na ọ bụ ndị na-arịa ibe eji arụ ọrụ na ndị na-abịakwu ya abịa. The patient is the center of ụlọ ọgwụ. Ụlọ arụsị anyị ebe ya bụ accessibility. Ndị mmadụ na-emebi access na abịakwa nke ọzọ bụzi utilization. Onye onye bi ofu obodo osi obetara klaasị eme ma abịazi ebe ọzọ. So ọ na-adị anyị mkpa maka arụsịsị ya na a ga-enyuzi onwe ezigbo rọba. Oge ndị bịara mọnịtụ ihe ya na head post. The head post maka nke eji edezi damage. I wrote a special recommendation for the needs and the nurse of the an excellent nurse, even though they are health post. And the government brought all the super and do a good that's support here. Go back on the slow, who's on people, those that they don't really like Papa. And see, I think it was the people or something like that. So all the member. So I make a no village. We're not about to. Some of us one day when you be a physician as a doctor. You become a law system. The first one will train the doctor to be. That's what I get. I can hear. So only of them got the president, former president, about the South Africa, I think, the German worker, Deba, Russia, more in Africa, so the line and I go to it. I'm not a taxi, 90 Namacho Pueblo. I'm not a taxi, no, of photo. Never has a doctor. And I think you are said now, in that mind. Fana Egorima and daughter. First, Superior with that room. So I'm making the Bigger Foundation in a special way. If I put a mobile clinic out around, if I advise on what I won't get on our pandemic. I don't go to the weekend. It's always one for the last year. I'm not media or home. The one I wear, nobody on any other. So I'm not your Namish Obiagu, who may prepare. I don't want to know they are not going to say or they have called. I do not want to say, now from that ear to the ear, now you say. Now I'm going to be there. When I'm not got up of poetry of God, no. Neither way, in our party, when now, we made our donation as no way, under my law. We may never go at all, no. I'm going to reach you. But I'm going to feedback. When there's a great of the pictures are in there. I give her all primary now. I believe better photo. These are not family line who's not represented to be this iPhone. So I believe there's a Obama or female president. So I'm the one all the necessary support. Government can know. And even when I promote the necessary system, all of the countries here, they deliver good health to their number. Of course, also tomorrow, now they go. Monday, 10,000
our sister Chima, how difficult it is. And then I know that I just so easy. I'm going to so many times when I have someone, I'm going to tell of medical supplies. I'm going to say, I'm going to but at least when such a thing comes up again, I'm not going to say, about this thing because when I came and discussed this thing before, and I understand you and I tried as much as I could to give us some pointers. Because some nearby non-American with me when I had this with them, and she just put it one of them. So over everything I always support her. When we started before, I had contributed. What I'm going to do is to man around the car December 6th time, so number 6. And each time I cost from 2,000 something. So it is not easy. And because I'm very busy, those people will be busy. I'm not going to go to the my other go there, he has to so that you go to see well, I remember which are the young medical outreach Nigeria. We other the government of our state and even Nigerian government. So, never so many times we never about China and there are a lot of things. So we get some of you on WhatsApp and on Facebook and some of you on there. We have and then overseas and I contribute maybe he was our teacher, he was our lawyer. Now so in order to continue to help, when I when I see in America, so when I'm in America, when I'm a member of that intro or something, or I'm not or something, we can move on my way home. So it's a good to see that in America.
Yes, okay, good and you come on and I'm at your wheelchair on a yes,
I don't know. I'm making on. Oh, my put the second daughter. My day is not so. And I don't want to go back. I even placed in the US. One other baby. So I put the project director of this healthcare committee. All the people in the US, they may meet through teleconference. We will put them at this health center. So this is just to raise awareness. Why are we here today? More is coming because this is just the beginning. But then to share this way, look at the Chima, also everything. The PG, President General Kowako, he will come here, represent our Honorable Commissioner for Health, before he made, because I will have to invite them after a while, how we can get the government to give us that support. But if we complete this health center, we need everybody's support. One person, we need everybody. Munachima, yes, we're based in US. Our goal is to reach out to different communities. Their grants will reach out to international communities. My case will be grants to build this, to complete this health center. And center, Bukari, I'm not going also. And I'm praying our transport government in around, or anyone around here. The government is only there to support. You want to provide the guidance for all the community when it's health center. So people know anything, only people know. No matter how small, we'll still ash. Materials, building blocks, we still accept them. So put all this in EJ, we wear blocks right now here. People, you can donate blocks, we'll still accept it. Because I don't know.
Oh yes, people can follow Dr. Mrs. Uchon, I can do Adam.
The buying down.
Thank you so much. Everybody, I cannot do it. And you know how to do it.
People, they are aware that I do here. I see I have a little Makanya Urubana, Urudugere, I was kind of more like Urige, but not bad for Umado Yago. Now I have a I lay 10,000. I will
Health center, as my health is wealth. Health is wealth. Oh, you don't do. Batego. Oh, yeah, silike. Oh, yeah, silike. Na batego. Oh, yeah, silike. Batego. I am waste the time. Nego ako na yendo. Ate hega yeba. So na odumpa. Kita mpotagolo. Nanja etipa my own money na so I am a G I made you 10,000 naira worth of support.
5,000 naira cash, not supporting anyone. One point of the
May we know you?
A participant. Okay. Yeah. All right, I'm Oma Umezuke, and I'm both here and in the United States, and I'm a native of Obiagu. This is my father's home, my heart, and I'm so happy to be here today for this health center project. My sister Chima has been working on this beacon of hope for several years. It's been her focus on her life, and I helped her initially to write a lot of the paperwork concerning the NGO. And today is one more milestone in the hard work that she and a lot of other people who are collaborators have joined to create this great moment that we have the possibility of a functioning health center. This building has been like this for about 8 years now, and finally it looks like something is going to be done, that we are actually going to be able to produce the funds, the effort, the energy needed to make this dream, this hope of this community a reality. So I'm telling all of you out there, when they talk about Africa, they give you the data, the World Health Organization, the United Nations, the Nigerian government. They talk about rural communities, poverty, the needs we have. This is it. This is ground zero. We need your help to help us make this a reality. I can, go anywhere I want to get medical help, but many people cannot. And what we're trying to do here is to make it possible for anybody, including myself, to go in here and get care, good care. So please, this is a plea for everybody to join hands. My community is your community. We are all one. Together is our strength. I thank you all.
Mother, where are you from?
I'm from Obiagu.
Yes, I know. Where are you married to?
Ogidi. Yes, Anambra State. Yes.
We don't know what to tell you again. We said that we are happy you came around.
I'm happy to be around. I'm not a medical person. I'm a retired teacher. You know, part of what we will do with this effort is also awareness, education, and that is where I come in, because currently we are working on a girls' initiative. We know that the issue of sexual harassment, the issue of child defilement, rape of minors, abuse of the girl child, these are major issues in Nigeria which are being addressed by state governments and by the police. One of the things that this NGO wants to do is also to address the education of girls and education of the community on how to protect the girl child, so that the girl child is healthy, is safe and protected, and grows up to be a productive member of the society, you know. So that's part of what this NGO intends to do, that we are going to work with a separate focus on children who are girls to make sure that they rise.
That comes to mind. Tomorrow we are going to Abacha, and obviously it's like that might be the focus of you know, education when we get there.
Yeah. Well, you know, it's an ongoing project. Sometimes, like today, if you come, you can set up a program and then you go with the flow. We said 9 a.m., we didn't start until very late because of how people come and so on. So some aspects of our programs may not emerge when we think they will, but the programs are there. And we'll keep taking advantage of what we see on the ground as we walk. So hopefully, every year, you know, she has been doing this since 2008. Every year there's a mission somewhere. You know, not just Amici. We've done in Igbo State, we've done in Delta State, we've done in Edo. So it's a marvelous effort. And also she has outreach activities in New York, which is geared towards fundraising. So we are doing the best we can. Yes. And I give credit to my late father, Philip Ojimezoke, because his drive and the gift he gave us is part of what created this organization. Yes. So I thank you all.
Thank
you so much.
Happy to deal with you today.
On existing protocol, my name is Raphael, so it's okay, lawyer. And by the grace of God, I'm happy to identify with the great team, the committee that put today's event together. I must start by recognizing the President General of Obiagu, the person of architects, is the women Chinedu. Thank you very much. The number of people who have actually helped us today, in one way or another, this is
I'm architect Chinedu Nzekwe, the President General of Obiagu Village.
Okay, what's happening today?
The land of Obiagu. We are trying to make a health program in the community for the benefit of the less privileged ones. At the same time, do a lot of activities that requires people's support to complete the project, the Obiagu Health Center we have at hand. So that's actually the program we have at hand for now.
In the hall, we saw lots of crowd. How were you able to push or carry these people along?
These people, Obiagu is a community, a likable community. Whenever they have occasion and they call people, they answer them. And most people you see there are our friends from different parts of Nigeria. They came to grace the occasion and they supported what we are doing. They encouraged us so that we can work harder. Because having an established hospital, a health center in a community is a milestone to the people in that environment. So they are our friends. And,
how do you feel this is happening in your regime as the people of Obiagu?
Yes, things happen not by mistake. It's where God designed it. Well, I as a person is people's choice. So people have to do everything possible to support the program, whatever we have at hand. And we thank God that it's happening during my own time. That this health center will come to be a reality. Thank you.
What can you say about Beacon of Hope?
Yeah, Beacon of Hope is our sister's program. She has been operating for a while, originated from US, and they've been of help to so many people. So when this program of health coach came in, they reached us, not even we reaching them. When they heard of it, they reached us. And for the fact that our sister is the director in the program, they came in company of the village to handle this program we have today. And it's a welcome development. They've given so many people some treatments today, free medical health, checkups, and so many other things, and which they have promised to run annually in this community. So we really give our sister, a thumb up because it's not easy.
BD, for your candid opinion, when and how do you think you finally actualize this dream?
From all indication, I don't think this year will pass us. I don't think, because there are so many encouragements coming from here and there. People from this community and people beyond. So with their kind of expressions and encouragement they are giving us, this project will end this year. It will be fully commissioned after completion.
With full medical
equipment there.
So what kind of health center are we looking at?
Yeah, we're looking at a well-established health center,
a hospital,
a complete hospital. If it requires the expansion, we have land. Yes, every field of medical will be there. The general practitioners, the specialists, the laboratory area, and
possibly a mortuary.
Purely mortuary, of course, because if you're talking about the living, you talk about the dead at the same time.
At a subsidized
yes.
Okay.
All right.
It's actually like a wait. People of Obiagu and all the well-wishers that came around today.
All our dignitaries for today's occasion, I thank God for their safety as they came. They have no problem on the road, and I pray to God that God will lead them back to their respective homes without any obstacle on the road in Jesus' name.
Amen.
Wherever they dish out what they gave to us in support of the hospital projects, I pray that God will replenish to them in thousandfold in Jesus' name.
Amen.
It shall be well with us and with the village and the friends in Jesus' name.
Amen.
Thank you.
You gotta get up. You gotta get up and make a move. 'Cause the world will never see you until you do. No, they don't really care what you're going.